who came up with this rule? Why do we have to cut our beards? Like, and knowing fully well that nursing is not all nurses that work as a bedside nurse.
Yeah.
I used to correct what nurse is calling student nurse. I'll tell them they are not student nurses. They are nurses.
Hi guys, welcome back to Beyond the Scrub. We have yet another beautiful brand new segment of Beyond the Scrub where we discuss professionalism and excesses in nursing. And with me in the studio, I have my beautiful co-host, Bright Shupeko.
Hello, everyone. My name is Bright Shopeko, and I'm the co-host on this session today. This is Beyond the Scrubs, where we see beyond the scrubs and we go into the real, unfiltered experiences of nurses. This session is a different kind of style where we are here to hear opinions from a veteran and a young nurse in the profession. So today we have a seasoned professional, a seasoned nurse, someone who has served on the wards for years, who has built up experiences enough to fill our libraries. And we also have a young nurse, someone who was served as the SCG president in the school and is now working in the psychiatric care. So join me, welcome Nurse Olatunji. Join me, welcome Nurse Akintona.
Okay.
Thank you.
Thank you very much.
Okay.
So yes, today we are going to be delving into conversations that are rarely spoken about. First of all, I'd like to talk about the rules. This is something that I'm very sure every nurse would like to hear about. In nursing school, there are rules. Do not dye your hair, do not wear colored hair, look groomed, barb skin. Okay. No beards, no mustache, look groomed is what is the rationale. Now, today we're going to be talking about where um, the line crosses professionalism into unnecessary restriction. I'd like to hear from you, Nurse Olatunji.
I think I can give a practical example to that. My first week in nursing school,
Mm-hmm.
having been someone who has gone to an institution before coming to nursing school, my first week, I think if my first class with a particular lecturer, she had to call all the guys outside and told us, if you are not barbing low cuts, you should be on skin cuts, and you are not allowed to keep beards at all. I was actually shocked because it is a new environment. This is not a military school. Like, why do we have to have rules like that? Yes, you understand there are scientific rationales behind some of it, but to some, it looks like excesses, like it is way beyond just professionality. So we think we need to discuss more on that.
Yes.
Thank you very much. First, I will let you know that nursing, to some extent, is almost like a paramilitary entity. And if you consider military or paramilitary, if you have been observant, hardly will you see an officer, especially males, having beard. You may start observing that from now. Don't wear colored attachments and whatever. Don't keep long nails. Don't paint your nails. No wristwatch. If you consider it keenly, there are some patients that you don't even know they have mental health issue, especially if you are working in the medical surgical area. Anything can aggravate a relapse, most especially if such a patient is not compliant with his medication. So if you put on colored hair attachment, such a fellow may hit you. Thank God Mr. Gbenga is from the mental health side. If you are injured, if the patient is hurt, he may tell you he's seeing something on your head. There had been a real life experience like that. Don't keep long nails. You and I know very well that we play with microbes by virtue of our profession. And if you grow long nails, invariably you are welcoming the microbes. There is no how you will perform hand washing. And don't forget, hand washing is not sterility. So if you keep long nails and you are being corrected and you are not taken to correction, you are writing a letter to an infection that may go out of hand. Let me share this with you. In my place of work, a few years ago, a nurse in children emergency room nursed a young child that was having gastroenteritis. Nobody knew what happened. She was having an infant as a child. In the early hours of the following day, she brought that child almost dead because the child started having diarrhea in the night. She was living in a remote area. It was difficult to get out. She was not having a vehicle, and it was in the dead of the night. So nobody could help her. It was around 6:30 that she was able to get a motorcycle that could bring her to the hospital. At the time she presented that child, she was almost gone, and they couldn't resuscitate that child. So it was an infection. The mother nursed a child with gastroenteritis previously, and the lady started stooling in the night, and before they could resuscitate, that child died. So, as a nurse, if you analyze the situation, you can boldly say that the mother infected the child. And you know, the best route of infection is fecal oral. So, people were now questioning, did you wash your hands when you were leaving the hospital? But the deed had been done, and it was irreversible. Don't put on jewelries. It goes in line. There are many things that we are being told not to do. Maybe because when we were being told, the senior colleagues were not giving us adequate information, especially the rationale for not doing it that way. And you need to know. If you don't know, you won't understand. And if you don't understand, you can't appreciate. And if you can't appreciate, you can never comply.
To start with, I actually agree with some of these rules, but there are some that I do not totally agree with. I understand the aspect of not keeping long nails because of fecal
Perfection,
oral
true.
infection, but talking of beards, keeping beards or having to cut your hair to the barest minimum, I feel because it makes me ask questions like how does keeping of beards or
It's
keeping
like
of
that.
hair affect the kind of care I render to my patient? Because I could remember a particular time when I was in nursing school. We were about to write an exam. Okay, we after finishing the OSCE, we have the time for Vival.
Yes, yeah.
So, and you know that during OSCE period, the examiners are not allowed to communicate
Mm.
with the students. So I think the examiners had to wait till the time
Speak.
of the Vival.
However,
So they told each and every one of us, the no nurses, that if you know you have beards, please do not come into the examination hall. We kept wondering, for God's sake, we are just to do this Bible and get out. We have to even perform nursing procedures on mannequins, Mr. Jones and Miss Jones.
Mhm.
So why do I have to cut? And funny enough, I was just having about 5 strands of hair on my chin. Why should I cut it
People.
before I enter the examination hall? I thought the examiners were just joking, but later I got to know that it was a big deal. So we had to go outside the hospital to buy shaving stick to shave our beards. Some of my friends then they have they had full beards,
Beards and
while some of us we had just
just
trans.
just strands. Who came up with these rules? Why do we have to cut our beards? Like, and knowing fully well that nursing is not all nurses that work as a bedside nurse.
yes.
There are some nurses that actually work in companies. Some work with HMOs. So are you telling me that they have to cut their beards before they work? I understand that. I think I once asked a senior colleague about the cutting of beards. What is the rationale? I think she told me that it was related to this infection that, probably when you are carrying out a surgical procedure or an aseptic procedure, you could contaminate
It's your beards.
with your beard. Probably a strand of hair might just
Drop.
contaminate or drop.
Mm.
But come to think of it,
That's why you have to
surgeons who actually operate on internal organs, don't they keep beards?
Yes, they do.
I'm not trying to compare,
Mm.
but why should we? There are better ways to go about these things. We can actually decide to cover our beards and hair. For instance, if you're a perioperative nurse,
Yes.
Okay.
you can cover your hair and
Yes.
your beards before the surgery, and when you are done, you remove.
Exactly.
So you would not have to contaminate that procedure. So I really do not agree totally to having to cut beards or having to barb your hair to the DRS minimum. If the hair is tidy and it is well
Exactly.
trimmed, I think we are good to go.
In addition to that, I feel we are mixing culture with profession. And I don't know, I'm not being judgy here, but probably because we have females more in the profession and they're like mothers. And you know how mothers could be like, okay, you need to like cut your beards and your hair should be like cleanly shaved or something.
That is a
So I
sign of
feel that
responsibility.
is why we actually weaved it around this nursing profession, because come to think of it, most of these things, apart from, yes, there are some that obviously you can say this has to do with your line of care. You have to like safeguard your patient's life, so you can't do this and that. But some of it are just way like why
Well,
that part?
let me come in. I want to start with the issue of you being chased out of examination room because you were having pets. The fault is from your institution. You're supposed to have been informed since the onset of the training, because it is not the examiner's discretion. It is the Nursing and Midwifery Council policy. I was at the Nursing and Midwifery Council's examiners workshop last year. Was it last year? Yes. It was mentioned. And policies are to be reviewed and to be upgraded. But if there is no priority on some policies, it will be left unattended to. I think it's high time that the males among us should find a way of reviewing the grooming policy for nurses generally.
Yes, can I add to what Nurse Oguremi said earlier? Talking of culture, I think it is also it is culture related because I have a couple of friends outside Nigeria practicing as nurses in the UK, in the US. Some of my friends actually dye their hair, some actually do dreads, some do braids, and I don't think it has affected their nursing practice in any way. And funny enough, they earn more than we do here in Nigeria. So what is the problem? And I think nurses, we've turned nursing schools to a glorified secondary school, and it shouldn't be. I know of a particular nursing school that the females are not expected to use attachments. The females cannot wear wigs to the classroom, not to the ward now. They are not expected to wear wigs to the classroom. Why? This shouldn't be.
From experience, such a school might be a missionary school. Because when I was working at a missionary hospital, such a thing happened. Even as a licensed registered nurse, there was a day I went to work and I was putting on a colored hair bun, and the color matched with my color of uniform. The matron summoned me for something, not because of that hair bun. So when she finished with me and I turned my back, I was about going, she called me back and was saying, this colored hair bun, and the matron then, she was from foreign country.
Okay.
Don't let me mention so that it won't be well announced. And knowing the type of a person she was, I turned, I said, do you mean this? My husband bought it for me and he loves seeing it on me. That's what I told her. And I was ready for anything that could come up thereafter. But if you know what you are doing and you can defend whatever action that you put up justifiably, you go with it. So she never bothered me with it again.
Thank you very much.
One thing I know is for females in nursing, our color is white and black. So if I want to put on airborne, I put on black. I am a Nigerian. I was trained in Nigeria and I'm still practicing in Nigeria. And I love to be law-abiding. Obeying the rules and regulations while at work doesn't reduce me. So I have no issue with that. Maybe because I'm a female. I'm not keeping beards.
Maybe. Please, can I say something? There's one other thing, because I feel looking good is a good business.
Yes.
Some of our patients are already scared of injections. they shouldn't be scared of our appearances as nurses again.
Mm.
They shouldn't see you as a nurse
And
and say, how is this person looking so awkward?
actually,
So if you have with a nice beard that is well trimmed and you have a nice haircut,
cuts
I feel it would even help patients to,
be
To
more
feel more
relaxed.
to feel
comfortable.
more
Exactly.
relaxed and comfortable with you instead
But
of
you've
you.
said it all. Well cut.
Yes.
You know our people, we know ourselves. If you give someone an opportunity to go 1 mile, they will go 10 miles. You too can testify that. I am not saying this to justify the policy, but what I'm saying is not everyone are so conscious of looking good. You can attest to it. When you see some nurses, even males, personally, you be looking at them as why this now? The males, the females also. There are times that I will need to call even nurses that we are of the same age. Yesterday, I was still telling a nurse, a senior nurse, that you are not looking good. And it's a female.
Hmm.
And there are male nurses also that will not look good. So if he's not keeping beard and he's not looking good, now tell me, how will he look if he's having a beard? I've told you, I'm not saying this to justify the policy, but looking good is so nice if all of us can look good. But as I said earlier on, the males among us should rise up. Because to me, that policy, nobody is looking at it. That's why.
I think this is a topic that is not well talked about enough, and thank you so much for your opinions on that. And yes, you also mentioned that our mommy here mentioned that we should have like a male nurse advocate that should revisit these
Yes.
policies and make maybe make adjustments where necessary, because we believe adjustments should be made. Like, we have fine guys upcoming in nursing. Let's not limit their potential.
Yes,
Yes,
please.
yes, please.
Exactly.
Yeah. Thank you very much. Now, another another major topic that I believe many nurses would also like to hear us talk about would be ways that disciplinary actions are, um, you know, carried out, especially in the hospital setting on the ward. Now, this is um, we're restricting this to student nurses and nurses, because most of the time it happens between student nurses
It
and
sometimes happens
nurses,
within nurses and nurses so
nurses
much.
and nurses as
Yes.
well.
Sometimes they tend to see public humiliation as a form of correction. Like, once things go wrong, you shout and all. And there's always this belief that people know, okay, nurses, should I say, feed on their young. Compared to the other professions, I would like to mention, yes, it is good to be honest and give honest opinions and reviews and all, but there are times, even when you make those corrections, if the patients should hear about some things, it would even affect their health badly, and they won't even have confidence in that particular nurse again. So it happens a lot of time during ward rounds and all. Senior nurses will just talk to nurses anyhow, like publicly, not, yes, we are prone to correction. Yes, you can correct people. There are ways to address things and all, but most times it happens publicly, and it's something that needs to be addressed. Or
Do you think public humiliation is really discipline? And where do we blur the line between discipline and harassment?
Thank you very much. I would like to say that there are many factors that are attached to this topic, most especially the senior nurses. I usually emphasize this. In whatever you do, whatever attitude you put up, whatever your behavior is, there are factors that influence it. Your orientation, your exposure, your level of knowledge determines the way you will behave. Many nurses that humiliate in court, in public, all in the name of instilling discipline, do not understand that it is a public humiliation. That's my own stand about it. So, they do not know. And because of their level of understanding. The humiliation you are talking about is, if I understand it very well, is the senior nurses shouting at the younger ones at the center of the ward, all in the name of correcting wrongdoings. But it goes beyond that. I'm in need of an instrument, and I have to get it from another ward. I have a health assistant, and I have junior nurses, students, or newly employed. If I ask my students to go and get that instrument from me, from another ward, what do you call that? To me, it's humiliation. Because you have ridiculed that young nurse. You have relegated her to an errand officer. In my place of work, they know me for that. I can fight it to any length, except I'm not aware of it. Many a times that I had even found my senior officers doing that where I was. Outrightly, I corrected it. I told my senior, politely, I just moved close to her. She came in with 2 male nurses. They were there to take, I've forgotten what they had come to take that day. I just moved closer to her and said, "Ma, don't you have health assistants?" And she just, she would find a way of justifying it. But I insisted. I said, no, it's not their responsibility. I will wait here for you. I will stand in for you here. Sign for it. Go back to your unit. Send your attendant. She will meet me here. And she left with the students. I used to correct ward nurses calling student nurse. I'll tell them, they are not student nurses. They are nurses. Yes. Because to me, they are relegating them. So call them nurses because that's who they are. So if a senior nurse is shouting at junior nurse, to me, she doesn't know what she's doing. But if I'm fortunate to be at the scene, I used to correct, reorient it. That the best way to do it is just withdraw that nurse. Take her to the room. Whatever you want to do to her, do it there. Then when you come out, you continue as if nothing had happened. And for those that are so close to me in the field of practice, they know that's what I do. I detest shouting at not even nurses, even my support staff. I detest it because it demoralizes.
Yes.
And I don't like anybody to shout at me too. If you shout at me, I want to retaliate. But after the whole thing, I will meet you at the corner and we will settle it. And I know it won't be palatable for that person. So that next time, she won't shout at me again. But my observation is this: even the younger ones that are being shouted at presently, that feels the pain, they're supposed to know better. They are the one, fueling it. Because once they start practicing, that's what they put up as an attitude. Meanwhile, when they were in that shoes, they were complaining that, oh, it's demoralizing, it's disheartening, this and that. They knows better now.
Yes, ma'am. Thank you so much for that, ma'am. God bless you, ma'am. I'm saying to my, I'm saying to my heart, God bless you, because we see this every day, and we are not seeing any change being affected to that cause. So I'd like to
It's our fault.
ask you, I'd like to ask you, ma'am, if a young nurse, whether a student nurse or an intern nurse or a nurse new to the profession and just working, happens to find him or herself in that situation, um, what would you advise that the nurse does?
If you start working today, you'll be a new person in the unit that you are being posted to. But by tomorrow, you are no longer an alien in that unit. You should get to know someone among your seniors that you feel I can talk to. There is no way you will work with 3 or 4 nurses and you won't find one out of them to talk with. So move closer. Express yourself. If you feel you cannot, go to the senior nurse that corrected you, humiliated you in court. So that fellow should be an intermediary. Because if you don't express your feelings, your emotions will be continually battered. And because many nurses, especially the younger ones, I don't know why, many are timid. They don't have that boldness and confidence to talk. So if such a thing is done today, you keep mute. Tomorrow, you keep quiet. It will continue. It will continue.
Right.
But if you express your feelings politely, the person will change. Yes, the person will change.
Yes, thank you
Right.
very much, ma'am. Because I had to ask that question to make sure that our viewers see the clear distinction between fighting for justice or making sure your feelings are communicated clearly, and um, disrespecting or disregarding your seniors' orders or flouting the orders. So yes, I just wanted to get that, and thank you very much because you hit the mark. I believe you have something to add to that.
Yeah, I actually love the way she addressed every questions I threw to her. you answered from an angle of professionalism and not just biased nature. I so much appreciate that. And right from time, I knew you are the best to like actually deliver
That's what Olatunji for
this
you.
session.
No bias,
Thanks so
unbiased.
much. I would still love
Thank
to hear
you.
from Nurse Akintona regarding this.
Um, I would like to support and agree with what my senior professional colleague has said earlier. And I think it is based on the individual's personality, because some of our senior professional colleagues, they react based on the kind of experience they've had in the past. Sometimes you hear them saying, in 1960, when I was still a student nurse, you know,
Classic.
you dare not do
exactly.
that.
So they begin to tell us stories of how they were bullied, but it shouldn't be.
Mhm.
Things are changing. And I think there's something called constructive criticism.
Yes.
There's a way you can correct an individual politely. You don't have to make it public. And it actually affects, being a psychiatric nurse. I understand that it can affect one psychologically.
Yes.
I've had some colleagues that will tell me that, oh, because of this experience, they don't think they can practice nursing.
Hmm.
They lose interest in the profession. And gradually, we are losing
Good
quality,
hands.
good hands. We have nurses that actually have passion for the profession, but because of the experiences they have with our senior professional colleagues, they just lose the interest. They tell you, "Hmm, you are proud of what? Which one is proud of? I'm not proud to be a nurse."
That
Mm.
happens a lot.
So there are times that, and I think probably some of our senior professional colleagues are forgetting that we learn on the job. Students would make mistakes, and when
Even those that are no longer students, we still
we
make
still learn,
mistakes.
yes. So you keep learning on the job. And when you observe that, oh, probably during ward round, a nursing student had made a mistake, you don't have to voice out at that very moment. You can wait till after the ward round, then you would invite the nursing student and correct him or her constructively, politely, regardless of his or her age.
Hmm. That age.
Yes. Because you hear some senior professional colleagues say, ìwọ ọmọdé yìí,
Do you know how old I am?
ìwọ ọmọdé yìí, ibo ló ti dé?
Mm.
You understand? So you hear a lot of things, and our senior professional colleagues don't understand that it affects us psychologically. So I've had an experience. In fact, I have a colleague of mine that at the moment he is not working as a nurse. He has quitted, will I say he has quitted nursing, but he's not just working as a nurse currently due to an experience he had on the ward with a senior professional colleague. I think it was this issue of shouting, having to shout, and I think he was even sent out of the ward because he did a mistake or something. So because of that, he just felt, I don't think this nursing is the way. Because come to think of it, even after the whole stress, the pay
Encouraging.
is not encouraging.
At all.
People don't appreciate us enough as nurses. There are a lot of things that people just shy away from. That okay, don't worry, I think I have this passion to care. So regardless of what people say, I will still. But when the senior professional colleagues are not even helping matters, you just see
You know, I've
nursing
said
students.
something earlier. A student of today will become a senior professional colleague tomorrow. It is, I don't know if I can say, will I say it's inbuilt or it's acquired? And I said it earlier on. If you have had an experience like that, can I be so sure that you will not exhibit such later? If you make up your mind that I will never do such, if I make that decision, it goes round, you will see that in no distant time, such will be completely eradicated. But it's so disheartening that people that had had
That's an experience.
such experience are still doling it out to younger ones. So that's why I said a student of today, a junior nurse of today will become a senior nurse tomorrow. If we can work on that, we will get over the issue.
All right. If you had to draw much on topics relating to this, I know we'll spend a whole lot of time. We can't even finish today because we have a whole lot of things happening within the profession and that needs to be addressed. But definitely, maybe some other time we'll still have our professional colleagues, our seniors and all around again. To Nurse Akintona, I sincerely appreciate your delivery and all. And that is it. Male nurses are also very, very, very much intelligent. Fine boy day, brains still day. So
Thank
it
you.
is balanced. And Nurse Olatunji, we sincerely appreciate your delivery. The fact that you fall between this should I say millennial category and you can still relate well with the Gen Zs in code. So we sincerely appreciate, and I think that's a wrap for today.
Thank you very much.